I mean, I hated being a teenager. Being a teenager is awful. But if you're doing that alone and going down all these rabbit holes, I think it's no wonder that there was an explosion of lockdown. They should have been going through the hell of being a teenager together. And I think it did have a big role to play.
I'm Jane.
And I'm Bex.
And this is
Insightful Sisters.
Hi everyone, and welcome to Insightful Sisters. We've got the second episode of Mum's Undercover tonight. When we looked around for parents willing to talk about having trans-identified children, we wondered if anyone at all would come forward because it is so difficult to discuss. But in the end, we had so many people that we decided to have 2 episodes. So the mums you're here tonight have been so generous with their stories, and it's a difficult thing to talk about, but we hope that you will listen and stand with them and share their stories. Okay, thank you so much, Wendy and Julie. It's really generous of you to come and speak to us. You both are parents of trans-identified children. Am I using the right term there? Is that a term that you would use?
Yeah.
Yes. You're happy with that? Is that how you would describe your children too?
Yes, because I wouldn't say trans, I would say trans-identified.
Right. So tell us a little bit about your kids. What are they like? Julie, should we start with you?
Yes, so it's my son who's been affected with this. He's 21 years old. It all started in lockdown. He's, well, as I now know, having found out a lot more about it, he's a classic rapid onset gender dysphoria boy. He's very smart. He's very gentle. He's very kind. He's a little bit socially awkward and geeky, into Dungeons and Dragons and all that sort of stuff. Musical, completely unsporty, and not a sporty boy's boy. They're probably gay, and yes, it's just tragic that he seems to have got sucked into this.
Mm-hmm. Is it similar in a story for you, Wendy?
Yeah, it's my daughter, and again, it started during lockdown. Absolutely no indication before that she had, any kind of unhappiness with her female, body. She was a girly girl, not a tomboy. And yeah, it just came kind of completely out of the blue, kind of during lockdown. And then I thought she kind of was growing out of it. And then, so she declared herself to be non-binary and changed her name, but she never asked me to use her new name, so I never did. And then in March last year, after a suicide attempt, she told the family that she was trans and she had to be referred to by a different name again and use the he, him pronouns.
So no indication beforehand. So what was earlier school like for your daughter? What were they like as a young child?
As a young child, I used to always say she was a cup half full person. She was such an easy child. She's the youngest of 3. She was a bit of a scatterbrain. She was a bit quirky, but she was happy at school. She had one particular very close friend, but she seemed to get on with everybody, all her classmates. Enjoyed going to school. Was doing really well when she moved up to high school. And initially during lockdown, I thought because it was just me and her in the house at that point, her older brother and sister had moved. They had moved out. And when lockdown first started, I thought she was coping really well with it because I had to go. I'm a nurse, so obviously I was working, and I thought she was coping really well with lockdown. And then, like literally out, completely out of the blue. When I'm trying to think back to timelines, it must have been when things were starting to open back up again. But all of a sudden, she just completely withdrew. we'd always, because it was just me and her, we were really close. We would sit and watch TV series together. She would come down and watch TV with me. We were always going to the cinema, and, we'd quite a lot of shared interests. And then she just completely withdrew, wouldn't come down for meals, would take her food upstairs. And I was really quite concerned. And my initial thought was that she'd had some unwanted attention from a man, but she just refused to talk about what was wrong, what was bothering her. So that went on for a good few weeks. And then her older sister, I got her involved, and I was like, can you please see if she'll talk to you? And in the end, my older sister came down, and she's like, she wants you to know that she's non-binary. So, right, okay. And I probably rolled my eyes at this point, didn't really understand. I understand what what they like to think non-binary means, but, I just thought it was a phase. She'd started wearing a breast binder, I think, at that point, which I don't think I realised at that point till much later, till I found it and then realised what it was. But she never, as I said, she never asked me to call her by her new name, so I never did. And I knew her friends called her by her new name, which was basically just a shortened version of her name. So I just thought, it's a nickname, it's fine. They were all doing it. They all had nicknames that they called each other. And I didn't really, in my naivety, didn't really think much of it. I thought, she's 15, she's a teenager, she'll grow out of it. I've always been what they call gender critical. Well, not always, but I became aware of the kind of trans issue in sport. And we had quite a few heated discussions about whether trans women should be in female sports. So she knew my opinion on that. And I think she just extrapolated that to mean that I must hate all trans people. I was accused of being a transphobe, that her friends were too frightened to come around because I was transphobic. So that was when she was about kind of 15, 16.
I was thinking when we read the cast review, we read that list of the criteria in a way that was so often the children that were drawn into this. Did you recognise your children, your son there, Julie?
Definitely, yeah. And there was, when I first heard the term ROGD, it was I can't remember the name. It was on the Wider Lens podcast, and they were just going through the list, and I was just thinking, oh my God, that's my son. Yeah, he's 100% this. And the more I looked into it, the quiet, the quirky, the gentle, the stubborn.
Yeah.
They're very much ticking all the boxes. And so many of the kids, they just, there's not so many boys in the parents' groups. I think typically it is about 2/3 girls, 1/3 boys, which I think is fairly representative. But pretty much all the boys in the group, all the parents, they all seem to be the same, cut from the same blood. But also, like Wendy was saying, very easy child, no problems when young, very easy to get on with. We never had any discipline problems or any going out getting drunk problems. He was top student all the way through school. And I mean, we didn't. First, we realised that he was going through this was when we noticed physical changes because he'd already started hormones. We had no lead up to it at all.
Oh, right. So how old was he at that point?
18.
18.
He was ordering them. As soon as he got 18, he started ordering them online.
Right.
No doctor's opinion or tests or anything. Just he went straight to the dark web and started ordering them.
Wow.
I think that again seems classic of the boys. They're not interested in talking. They just go straight there. And it was a full year over a year after that before we actually kind of twigged and got to finally open up and tell us.
I mean, you've spoken there about not finding out until you actually saw physical changes in your son. I want to roll back a bit because both of you mentioned lockdown. And we've seen a pattern of this, I think, where a lot of older transitioners, adolescents and young adults, lockdown was a really hard time for them socially and in terms of their mental health. And an awful lot of people sort of mislabeled their unhappiness during that period as being due to transition issues. What sort of a role do you think lockdown played? Do you think it was a complete transformation during that, or?
I think there was a big role. I didn't appreciate it at the time. I remember thinking that the age of our kids were actually not doing too badly with lockdown because our older child hadn't yet started going out, partying and clubbing. So I sort of thought, well, he doesn't know what he's missing. And our younger one was just finishing primary school, so she wasn't missing out on that side. But I think they did having now seen what my younger daughter does in terms of social stuff. Now she's coming up to similar age. I think they've missed out but they obviously missed out massively on what normal teenagers would be doing, just going out and experiencing the whole social world. So they did become very internalized. And I mean, I hated being a teenager. Being a teenager is awful. But if you're doing that alone and going down all these rabbit holes, I think it's no wonder that there was an explosion of lockdown. They should have been going through the hell of being a teenager together. And I think it did have a big role to play.
Yeah, absolutely. I mean, so much of what you learn about who you are as a teenager is learned through the relationships and friendships you have with other people.
Yeah.
Wendy, what about you?
Yeah, as I said, I thought at the beginning of lockdown she was coping really well, and then I think it was all their kind of socializing, if you like, was done online. Everything was online, and I think it normal teenagers, as Julie said before, they should have been going out and experience normal teenage angst together, but they weren't. They were stuck at home with their parents. Any feelings of unhappiness, I'm sure these TikTokers and all of it. I mean, my daughter even developed the TikTok tick. She suddenly developed a tick, which I later learned was a craze that all these influencers that these kids are listening to online. And I'm sure she just fell down, trans rabbit hole, with nothing else but social media to keep her entertained during the day, and that was it.
Do you remember the first conversation that you had with your children, or the moment that you sort of realised, oh, this is serious, this isn't a phase, this is like a new identity? I mean, obviously for you, Julie, you've said you sort of noticed physical changes. What was your reaction in that conversation?
So there was, let's say, over a year between us first noticing, because, and this is where it gets even more bizarre to a certain extent. So the first time we noticed, we were on holiday, and we noticed there was some breast growth, and he complete loss of body hair. So, well, that's a bit weird, going through a late puppy fat stage. But it was a busy summer. He was starting university, lots of stuff going on. So he came home to visit at university, and we thought, oh, well, breast growth isn't really noticeable now. And he's got hair on his arms again, so it must have just been something a bit odd. What we found out subsequently was he was wearing a sports bra to flatten his new breasts. So it's like, he's grown new breasts and is then biting them. It's like, how does that make sense? So, we sort of allayed any suspicions and fears because we thought, well, he's slightly, the breasts are gone and he's got hair again. So he's got long hair, but he wasn't presenting as a female in any way. But then the following summer, when we had a longer time on holiday with him, we noticed again that he definitely did have some breast growing, and so we sat him down and said we were concerned that it was a health issue because he has an autoimmune disease which could have caused this. So we said, look, we think when we get home you should go and see a doctor, and he just went very quiet. He didn't say anything. And then we said, are you taking hormones? Is this something you're doing deliberately? And he said, yes, yeah, I'm trans. At that point, you don't on for every year.
What was your reaction to that? I mean, that must have been
We
shocking.
were because he essentially didn't present feminine. He hadn't had any issues. He had a boyfriend. He had long hair, but that wasn't an issue for us or anyone we knew. So we were very shocked, and we said, well, we love you, we support you, all the right things. All that I had not really anything to do with trans, had very little knowledge about it, but what I did know and what kept just going round in my head was, oh, I'd rather have a live daughter than a dead son. Heard some radio play or something on radio before about it. And that's just kept going through. So we just sort of said, okay, well, whatever was for you, we love you, but you shouldn't be injecting yourself with hormones that you brought up the internet. And, if we're going to do it, we have to do it properly. So that's when we offered to pay for him to go and see a gender doctor, thinking gender doctor would have a good chat, and realised this was just teenage angst, and it's, it was all nonsense and getting sorted out, because we had no knowledge about the gender industry. But of course, after our consultation, gender doctor completely agreed that, of course, he should be on hormones, but he shouldn't be buying off the internet. He would sell them to him instead. But we said, did he want us to tell the wider family and his sister and all the rest of it? And he said, no. So we hadn't told the wider family. His sister doesn't know. Because he still doesn't present. I said, well, he looks like he wears big baggy clothes and you don't see his breast. And he just looks like a scruffy young man with long hair.
And Wendy, how was that for you?
One of the things that I've found quite hard is that my daughter and I have never had a conversation. She refuses to talk to me about any of it. So, initially I was concerned about, as I said, trans women in sport. And I wasn't aware of what would happen to young girls if they're medicalised. So, tried to get as much information as I could. And now, initially I was happy to buy her, boys' clothes. That's what she wanted, what she preferred to wear. We went on shopping trips, trolling around charity shops. I didn't mind that one bit. I didn't mind how she had her hair. It's been every colour under the sun. Didn't mind, how she had her hair, how she presented to the world. Didn't bother me at all. I just didn't want her to, once I found out, the kind of harmful effects of testosterone, I just didn't want her to go down that road. But it was something that she absolutely would not discuss at all. So kind of from 15 to, 19 really, things got a bit better between us. We kind of ticked along and it just became something that we didn't really discuss. We went away with a break down to London weekend because we both love going to the theatre and musicals. Packet of cigarettes fell out of her jacket pocket. I'm a kind of anti-smoker. And I was like, right, you're not allowed to smoke in the hotel room. If you're going to smoke, you need to go, outside. And she went, right, yeah, that's fine. And then she kind of paused and went, do you care about what I do? And I was like, in what way? And she says, well, the smoking. And I was like, well, I don't like it. I don't want you to smoke anywhere near me. It's bad for you. But at the end of the day, you're 18. There's not much I can do to stop you smoking. You don't live at home. By this point, she was at university. She'd moved, away from home. But I did say, but that binder, your breast binder does concern me because that's going to cause you a lot of harm in the long term, a bit like the smoking. I says, but as long as you grow up to be, respectful and kind, hardworking, polite, I'm not really that concerned about, how you present to the world. And she went, all right, okay. And that was it. That's about the only conversation we've had. So yeah, unfortunately, it became a subject that we had to agree to disagree. Yeah, so that's been quite hard from having a child that was so open, so close to, shared all these things together, and she's just become quite closed off to me anyway.
What about professional guidance and input from professionals? I know, Julie, you mentioned you encouraged your son to attend a gender clinician. Do you had any sort of insight or any guidance in that regard? You very much closed out of that since your children are older.
Yeah. So I sent a background report to the gender clinic for someone to see them. And I said, I appreciate he's in routine. He was 19 bit by that point. But I would like to add some history in terms of like family history of stroke and breast cancer and this and that and his autoimmune conditions. And I described a bit about his childhood and I didn't appreciate at the time, but I was, again, just ticking all the boxes of ROGD boy in what I had put in this little summary. So they said yes. Obviously, they will report back to us that they had received that. So then, after our son had seen the gender doctor, which we paid quite a bit of money for, our son shared the report with us, which he didn't have to do, obviously, but he did, and I was glad he did. And I felt there was an awful lot in the report that didn't acknowledge any of what I had said in terms of risk factors and family history. So I sent another report to the clinic saying, my son shared the report with me. I would just like to point out this, and this. Relying on a teenager to report about family medical history in this sort of scenario is, like I said, naive at best. Negligent is what I would say. And I didn't hear anything back from them. Our son wasn't particularly inclined to move on to the gender clinic's hormones because they did suggest he stop hormones for a couple of weeks to get some blood tests, which was fair enough sensible advice, and he didn't want to do that. So he didn't pursue any more appointments with that. He just carried on doing his own thing online. But I did write back to them and I said, again, I appreciate you can't discuss my son's case because he's not a minor, but I would like to ask you some questions about the health risks of medicalizing with cross-sex hormones, because I'm his mother and I'm concerned about his long-term health. Would you answer some general questions about what happens to males on hormones? This was still fairly early in our journey, so I had a fair idea of a lot of the answers already, but I just wanted to get them to say something. And after a little bit of back and forward, saying that they wouldn't discuss him, but they would discuss general stuff, they said, yes, if I sent some questions, the doctor would answer them, but there would be a fee to pay for his time. And I said, that's fine. So anyway, I sent a long list of questions about specific health risks and basically saying, do you discuss this with your clients? And are you there if they have these complications? Will you be there providing the follow-on care and the ongoing care for these medical harms that could potentially happen? And then it put into the back. So he hasn't been back to them since. But that just summed up for me the whole negligent model of this healthcare. It's not healthcare. They don't care about what they're doing to their clients or the patients long term. And they're not going to be there picking up pieces. If anyone's there picking up pieces, it'd be us fair.
I mean, it's horrific when you put it like that and you sort of realise that is the sort of official and specialised route in this country. That's doing everything by the book, and it's the route that you're advised you're meant to take as a parent, yes. And it's still that much of a shambles. It's really concerning.
The other thing that the clinic offered him, so the clinic basically offers sort of 3-appointment package. The first one would be where you'd have your consultation. Normally, you'd go back for another one to give you hormones. Obviously, he was already on hormones, but he did agree after the first visit at the gender doctor that he would be quite happy to prescribe hormones. The second appointment is meant to be with a clinical psychologist, I think it was. So that was their next suggestion. Set you up with this a Zoom meeting with this psychologist, and that would be your next step to getting a gender recognition certificate. So this was after one appointment. So I said to my son, look, I'm not going to pay for a Zoom meeting. We can, if you're going to do it, and do it face to face with this psychologist. And I, again, contacted her beforehand and said, I would just like to know, because she did look quite qualified, to talk about body dysmorphia and teenage distress. And I thought maybe she would be appropriate. So I said, before we book this, I would like to know, is it a meaningful consultation or is this just a tick box exercise? Can you tell me how many of the patients that you get referred from this private clinic do you not affirm? Or are you just ticking boxes? And again, I never heard back. So we didn't go through at that point because I didn't see any point. They're obviously just ticking boxes. I didn't care.
Yeah, I mean, that's so concerning. Oh, Wendy, what about you? I mean, are you aware of whether there's been professional involvement in your daughter's situation or?
I suspect, because I found a letter, that she had been to the GP and asked for a referral to the Sandyford, which is like the Scottish version of the Tavistock. I don't think she went because this letter was unopened. But then in March of last year, after the suicide attempt, and then that's when she declared she'd gone from non-binary to she was actually trans. She'll have kind of medical professional involvement now, I suspect. She did tell me her intention was to start on testosterone as soon as she could, but we've been pretty much estranged since, for over a year now. I've had virtually no contact with her at all. So when she was kind of 15, 16, when I was kind of naively thought, oh, it's just a phase, shall we go to the GP? But I'm so glad I didn't, because I think that would have put her on the path even sooner. Knowing what I know now, I think it would have just put her on that pathway even sooner. But yeah, there'll be kind of medical involvement now. But, obviously she's 20 and she doesn't live at home. So there's very little impact I can have now.
I can't really imagine how difficult that must be to sort of be kept in the dark about it. I think I'll bring Jane back in to look further into the impact that this is having on yourselves and your wider family as well.
We both shared, in a way, something of the impact on you by what is happening and also by the things that you're trying to control and avoid, I suppose. Julie, you talked about the fact that your broader family don't know about this. You don't talk about it inside the family. I'm thinking that's a lot of strain. What's
Yes,
it like?
It is a lot of strain. It's definitely a big bone of contention between me and my husband. His auntie, who is very close to, does know, and he doesn't know that she knows, but she does know, and she also doesn't think it's sensible or right. But he's got one set of grandparents still alive, and his sister. So they don't. He's been away. We're not estranged. We're in regular contact, but he has been away out of country since October. So we've not seen him, but we're in regular WhatsApp conversations every couple of days, and he's coming back next month. So he'll be living with us for a little while next month, before he decides what he does next. So we'll see.
What's the age difference between your children?
4 years. So my daughter's just turned 17. And they've always been very close. And funnily enough, because I was thinking, I don't think she knows, but can't be 100% sure, but I'm pretty sure she doesn't. But after he'd been away out of the country for months, we were chatting about him at one point, and we always refer to him as brother and so he, there's no different names or pronouns or anything. And she just started having a bit of a cry, and I said, "Oh, what's wrong?" She said, "Oh, I just really miss my brother. I just really miss him." And I thought, yeah, they are really close. And I don't think it was any sort of existential, oh, because he's not my brother anymore. I think she was just genuinely missing him as her brother.
Mm.
So I do worry if he doesn't desist and if he carries on, it's gonna hit their relationship one way or another. If she does affirm him, I worry that she's going to hate me. If she doesn't affirm him, she's lost her brother either way if he carries on like this. If she affirms him, she's gained a sister. If she doesn't affirm him, she's lost a sibling.
How do you navigate talking about these things in general to her? Because I imagine she has friends.
Picked up, yeah. She called, again, quite a few months ago, I can't remember what we were talking about, but she said something like, well, you hate trans people anyway, didn't you? And I pulled her up and I said, no, I don't hate trans. I don't hate trans people. I said, I hate trans ideology that's telling people they're wrong and they need to be medicated and have surgery. I hate that. I don't hate people who identify as trans, who are large for. I think pity and help. I mean, obviously there's bad actors in there as well. But so, yes, but we haven't talked about it a lot. Partly because she doesn't have any trans identifying girls in her group at school. She's got really nice group of friends. They all seem really sorted and head screwed on. It's not, and actually in terms of we weren't aware of any, and the school weren't aware of him either because he'd left school by the time he started on the hormones or just about to left school. Yeah, it doesn't crop up that often because she doesn't have any trans identifying people in her circle.
So Wendy, do your daughter's sisters or sister, is it one or two sisters she has?
A brother and a sister.
Brother and a sister. So do they keep in touch with her?
Yes. So March last year, and when she came out as trans, and I kind of tried to say to the kind of wider family, look, it's all very well, but, can we please not encourage her to go down the medical route? But unfortunately, they were all, oh, she's so stunning and brave. And I tried to say to my daughter, look, there has to be a bit of compromise here. I will try my best with the new name. I will try to use gender-neutral pronouns, but I won't be lying that you are now my son, you are my daughter, because that changes my reality. I didn't give birth to a son all those years ago. I gave birth to a daughter. So, but if I was out in public with her, I'm not going to go out of my way to, so if I met somebody in the street, I wouldn't say, oh, this is my daughter. I would have said, this is my youngest, or, this is, her new name. That wasn't good enough. It had to be complete affirmation or nothing. So she estranged herself from me. Her brother and sister, her brother, he decided that, no, I was transphobic, so that was it. So he kind of estranged himself from me. Her older sister, she was just a bit piggy in the middle. She wanted to be there to support her sister, but she also understood my concerns. But unfortunately, her grandparents and her auntie and uncle have all gone down the full affirmation route. So it's now got to the point where I am now excluded from kind of family events. They all kind of meet up. In fact, they met up just last weekend, and I was excluded from that. So it's been quite hard when all you want to do is keep your child safe from harm.
I can't imagine that. To not have the support around you of your own family is dreadful. So how have you coped?
Wine. I've got a good friendship group, and it's strange because when you explain to other people what's been going on, everybody's like, no, you've done the right thing. How can anybody think this is, the right path to go down? But my family, for whatever reason, are completely the opposite. And it's not even a case of, well, it has to be something we agree to disagree on. That they obviously believe in, Julie said, a gender ideology. I don't. They obviously do. But people have different, believe different things all the time, but we still manage to get on. But apparently that's not the case with gender ideology. You have to be all in or you're excluded. So yeah, if I didn't have my friendship group, it would have been, incredibly difficult.
I think when I go to these, when I meet up with other women, I've had more hugs from other women in the last few years than I've ever had. And I think it's because we need that support, don't we, when we get together, because we feel like pariahs so many times in our ordinary lives.
Yeah. And certainly organisations like, Bayswater Support and particularly our duty group. I don't post things very often, but it's just nice to know that there are others out there that are going through the same thing, and you can, get a bit of support from that.
You talked about being a nurse as well. I mean, when this landed with you, your own training must have come back to you as what did that feel like? On the one hand, a medical professional.
Yeah, well, it's absolutely, I cannot comprehend how people in my profession go along with this. It's completely anti-science. We're always told that nursing is an evidence-based profession. There's no evidence base for this. The evidence that is starting to come through now, that this medicalisation is harmful. So yeah, it just baffles me that anybody can think that human beings can, change sex for a start. It does. It baffles me how people in my profession. I can remember talking to a student nurse. They weren't working with me. I was in hospital my older daughter was in hospital getting a procedure, and asking, just general chit chat. What area of nursing do you think you want to go into? And I want to go into gender nursing. And my eldest daughter kind of shot me a look as if to say, "Don't start, Mum." I'm like, what the heck is gender nursing? There's no such thing. But yeah, it's the way of the world, unfortunately. But I really wish it wasn't.
Do you feel, can you sense a change in the people around you, friends and family, things that are being discussed? Do you think that there's a change that's coming through?
I think most people live in a little bubble, and unless it's happening to you, you're not really aware of things that are going on in the world. So, obviously my friends from my experience, and I've, been saying, this is what's happening to young girls. This is what's happening to young boys. This is what they're teaching in schools. I like to think that I'm doing my bit to, whilst it's not doing my family relations any good, but I'm kind of trying to spread the word out there that these things are happening. And please God, that the number of children that it's happening, children and vulnerable young adults that it's happening to, starts to reduce. I think we've still got a long way to go. I think a lot of our kind of public institutions are very captured, as they say. But yeah, even our mainstream media doesn't report a half of what we know what's going on. So, the likes of my parents that are only getting their news via the BBC are having a very kind of biased, kind of view of the world, if you like.
What has been the impact on your children themselves? Because Wendy, do you feel your daughter is happier than when she originally decided at 15 that this was her?
At 50, once she kind of got over that initial kind of period of withdrawing herself, once she'd kind of come out as being non-binary, yeah, she did. Her mood did seem to pick up, and as I said, I was happy to buy the male clothes, and, the hairstyles never bothered me. And yeah, she seemed happier. So the suicide attempt, it came completely out of the blue, because I had been to see her through where she was at university. I'd been to see her about 10 days beforehand, and we had a lovely day. We went to the theatre, we went out for a meal, for a couple of drinks. We had a lovely day together. And then, so that came completely out of the blue. So yeah, that was a kind of difficult period. I didn't find out that it had happened till about 3 days afterwards. She'd contacted her big sister and not me. And then when I went through to see her, she was like, "Mum, I don't come and visit me. I'll let you know when I want visitors." So I was a bit, shocked by that, but I had to respect her wishes. So, but I can remember going on to the ward. It was a locked ward, and being let in, and said, B's mum, and they kind of looked a bit puzzled, and then I was like, oh, and then I kind of gave her her new name, and they were like, all right, I'll see if he's available. And I'm like, he? Who's this he? But they were talking about my daughter, and that's in hospital. So that was quite shocking that fellow professionals were using these There was no need to use. She wasn't within hearing distance. There was no need for, wasn't going to affect her in the slightest. In terms of her brother and sister, obviously that they just want to be supportive of her. No, God forbid, nobody wants her to try and commit suicide again. So I think everybody's kind of treading on eggshells. My mum did say when we were having a bit of an argument, and I was like, how can I make things better if she won't see me? And my mum said, well, she's always happy to see us. And I'm like, well, yeah, but this is the adult version of me saying, no, you can't have a biscuit before your dinner. And you coming along and saying, of course you can, sweetheart, here's 3. She's declared she wants something, and you've gone, okay, no problem. Whereas I'm the bad guy because I've gone, let's just look at the wider impact of this decision.
And you're looking at the big picture, aren't you? And you're saying this unhappiness is unhappiness,
Yeah.
whether or not you're trans identifying.
Yeah.
And that's a hard thing for other people to understand, because they will be thinking it's a simple issue of you just saying, oh yes, I totally accept you as the gender you're saying you are, and it will all be all right. But you're a mum, it. It's not as simple as that.
Yeah. So I question I'm not quite sure of the word I'm looking for, but I don't know how medical professionals can prescribe somebody testosterone so quickly after somebody's taken attempted to take their own life. Surely if you're so in such a distressed state, that is not the time to be giving testosterone. Surely there should be a period of reflection. Let's get you over this event and let's explore things a bit deeper. But it just seems to have been, all right, okay, you tried to take your own life because you're so depressed, because you're trans. So let's get you on this pipeline.
Meanwhile, they never get to the bottom of the distress that's led them into this. This is the big problem just building in the background. They don't go, okay, so why did you think you're trans? You were obviously unhappy. Was it just puberty stress, teenage angst? Was it because you were gay? Was it because you'd been assaulted? Was it because you just didn't feel comfortable? There was obviously a reason why these kids and young people are getting caught into this. But that never gets addressed. That gets just pushed down the line. And as you say, Wendy, giving someone who's very mentally distressed to the point of trying to attempt suicide, putting them on an anabolic steroid is not going to end well, is it?
No.
Then I think we'll pass across to Bex.
Okay, so we'll sort of come towards the end now. You mentioned Bayswater there, and I wonder from both of you, for other parents that are finding themselves in your situation, or, if you have adult children that are going through transition processes, what sort of support or what would your suggestions to them be?
I found our duty, which is another parent support group, about 3 months into after we'd found out what was going on. Parents of the sisters, as a sort of side offshoot of that, which is very encouraging. That just just meeting other parents, and most of it was just online. We have met, a few of us have met up in real life, but just knowing that there's other parents going through it, on the international chats, there's so many different types of families. There's religious families, there's divorced families, there's happy families, there's families that go camping every weekend and their kids have never had a phone until they were everybody's different. So it's not like we're all going, oh, well, we all did that. That was the problem. This is our fault. Just knowing that it's not our fault. It's been stacked against us. This has been grooming on a societal level. And it wasn't anything that we did as parents or could have done differently. So that, I really thought I was going mad and heading for breakdown. And just that little bit of contact with other people going through the same thing has made a massive difference. I think Bayswater I've heard a bit more about recently. I haven't actually joined them yet, but I think I will do as well. Because, just knowing that you're not alone and that it wasn't something that you did specifically is hugely helpful.
Yeah, absolutely. Wendy, is there anything that you found particularly useful to guide you or get you through this process?
Yeah, again, the kind of Bayswater and Our Duty, parent support, meeting up with other parents is just, it's been a lifeline, really, just to know that you're not alone out there. Yeah, I would be wary of medical professionals, and I would be, if I was, in hindsight, should I have been a lot stricter with social media, exposure to social media, probably, but yeah, that would be my advice to kind of parents of younger children is just, be so careful what your kids are exposed to online these days. You think at 15 that your kids have maybe got through the worst of it, but obviously not. Oh.
In many ways, this may seem like a very sort of obvious question, but I'd like to ask both of you what your hope is for the future in terms of your personal circumstance. What are you hoping happens now? Do you want to go first, Julie?
I'm hoping when our son comes home next month that he has cut down on his hormone use, if not come off it. He's maturing, he's reasonably, seemed to be reasonably happy in his life. And I did say to him, I think you're happier not because you're trans, because you haven't changed how you present to the world. I think you're happier because you've moved away, you've lived independently, you've come off a degree course that wasn't suiting you, you dropped out of uni, but you've had a job, you've gone traveling. I want him to appreciate that that's in spite of him being on the hormones, not because of him being on the hormones, and appreciate that the long-term health problems that he's already, his body's already going to have problems is not worth pursuing. So my hope would be that he desists, that detransitions and comes off the hormones. But I can't force him to do that. I just have to keep the relationship going, whether he does that or not, and hope for the best.
And Wendy?
Yeah, long term, I pray to God that she comes off testosterone. That's my big fear, and that I'm hoping, because she was always very squeamish, that she'll not go down the surgery route and get, a double mastectomy and things like this. That I'm hoping that she comes off testosterone. But short term, I would just like to get to a place where we can meet as a family. Trans issues never need to be discussed. I'd rather they weren't, but just, to be respectful of other people's decisions. I'm not the bad guy. He's just trying to keep my daughter safe. But yeah, I would just like to get to a place where I can meet my 3 adult children for a meal. That would be my aim at the moment.
Yeah. We come to the final question, which we ask every week, and that is if you both have a woman of the moment, somebody that, you find particularly inspirational or you think is doing really important work and deserves a shout out. Julie, do you have one?
Obviously, being in Scotland at the minute, I would go for Sandy Peggy. She's stood up and said, no, enough is enough. And I think a lot of us in different spheres need to be standing up and saying, no, we've had enough. We're not going to stay quiet anymore. Whether it's as parents or clinicians or teachers or whatever. We all need to be doing more of that. So I think we all need to be a bit more Sandy Peggy.
Yeah, definitely. I mean, every time one of these cases happens, it brings a fresh wave of awareness and a fresh wave of discussion. And that's for people, especially for people in your positions and in your position, Wendy, where the dialogue and the conversation back and forth has broken down. These conversations happening on a societal level must be reassuring, because they don't need to hear it from you. If they hear it on the news and from Sandy Peggy and from other women that are speaking up.
That's one of the things, as I say, it's a bit of a contention between me and my husband. But because he's worried that if I speak up or say too much, it'll draw a wedge between us and our son, which obviously I really don't want to do. But I think if we do speak up, they will hear it from wider society, because they won't listen to us. And you can't drag a loved one out of the cogs. They have to see it for themselves, and they won't see it for themselves if society is still playing along. So that's why I speak up, because I think we do need to change the narrative that they're hearing from other people, because they're not listening to us, but they are listening to other people.
Wendy, do you have a woman of the moment as well?
I've thought about this, and I would have said Sandy Peggy too, but I'm going to say the women. It's not one person, but I'm going to say the women of Mumsnet. I was accused of being radicalised by Mumsnet, but those, the women that so good at putting their point across kind of opened my eyes to what was going on. And when people were going, yeah, but that's transphobic, and they're like, yeah, but have you thought about, I'd never thought about trans women in women's prisons. I'd never thought about, trans women in changing rooms. I was probably of the, let's all be kind. And then obviously when I started researching more into the kind of child's transition, the young people's transition, there's some intelligent women on that website. And it just, kind of gave me, right, okay, what I'm feeling isn't, I'm not out of step with everybody. There are lots of people that are feeling the same way that I am. It's just the media, the narrative in the mainstream media is completely opposite to that. But what I'm feeling is normal. So yeah, I'm going to nominate the women of Mumsnet.
I love that one, because Mumsnet's played such a role in all of this from the start. I mean, the conversations that have been going on there have, they've been demonized, but
Yes.
they've been really useful to a lot of women on the ground level.
I love that too. I love the Mumsnet, and I love the Sandy Peggy, because we've had some great nominations in this, but there's always a theme of the way women give each other a hand up, and that is really, really helpful, especially when you've, as you two have, had such a lot to go through. So yeah, this has been really inspirational. I think you're both amazing. You're dealing with such a lot, and you're still finding time to support other people. So that's really amazing.
Thank you for having us.
Yes, and thank you for, you're speaking up as well and getting lots of interesting people on and spreading the word too.
Well, we try.
Do our best. Thank you so much for making the time, and obviously, yeah, I'm sure all of our listeners and us hope that everything sort of works out as best as it possibly can.
Fingers crossed.
Thank you to our listeners. We really hope that you've enjoyed this episode. And if you have, please do like, share, comment, subscribe, all that good stuff to help keep our channel growing and spread the word. Thank you.